Well, thank you all for joining me this afternoon. We did get reagents and supplies today. We do expect more will be coming in the next few days. We had 385 tests that were pending to be processed today. We resumed testing of the high priority cases. We tested 94 of those today. 3 of those came back as positive. We had 91 of the 94 that came back negative. At this time, we can share that all 3 positive cases are from Beadle County. Our infectious disease team will be investigating to determine if any of these cases move us to community spread. Community spread is defined as 3 different things. There's 3 different levels to it. One is none. COVID-19 cases may occur in the community, but there is no community transmission. The second level is minimal to moderate. That means that there is a single case of community-acquired COVID-19 in a county. Substantial, there are 5 or more cases of community-acquired COVID-19 in a county. And again, but today, as far as we know, we're still not at the level of community spread, but our infectious disease team will be speaking with the 3 positive cases that we have today to determine if any of these cases move us to that level. We do have 2 of these individuals that came back positive today that are reporting travel. 2 of these are reporting being in contact with COVID positives. None of them are hospitalized at this time. And we'll have more information for all of you tomorrow. I wanted to give you a couple of updates. State employees today, on their behalf, I signed an executive order extending telework activities for state employees until March 30th. For businesses, I certainly understand that this is an extremely difficult time for you. I understand that it's scary. We also, though, need to talk about how people are coming together, how they're working together to take care of each other and each other's families. And we need to really spend some time sharing some of the good stories that are going on in South Dakota. Like right here in Dairy Queen, the owners of Dairy Queen have purchased iPads for those that are vulnerable and shut in at some of our senior facilities. We even had one young 17-year-old here in Pierre that gave up his hours to someone else who really did need the work and the payroll in order to pay their bills. We have grocery stores that have set aside separate hours for the elderly to come in and shop for their groceries so that they didn't have to be concerned about coming into contact with other individuals carrying the viruses. We also, when it comes to schools, have just recognized outstanding performance in taking care of kids and families that are in need. The manager for the Todd County School District informed us that they are processing and putting out 5,000 meals a day to children in their area. 123 of 149 school districts are providing meals to kids throughout all this time when they're not actually in their physical school building. Now, I know childcare is difficult for some of those, especially those that are healthcare providers, law enforcement, people that are in essential positions that they need to show up for work every single day. I'm going to ask people across the state of South Dakota to be creative, to show up for these families, to figure out ways that we can take care of their children, give them peace of mind while they go out and serve each other during this time, that we're all working together to make sure everyone stays healthy. If you are not in the vulnerable population, I'm going to ask you to step up and see if you can do some of the activities that others are doing across the state, because it certainly is inspirational for me personally and for everyone that comes into contact with how they are serving each other and really working to get through this situation. We will get through this. We always do. We're tough. We are people that can withstand extreme weather, flooding, good times, hard times, but people here are special. And along with all of the folks who call this home, you don't just end up here. You're here on purpose because you love the state, you love the people that are here. And to be a South Dakotan is to be someone who really understands what family means. And we are all family, and we will get through this together. So with that, I will open it up to any questions that you may have. Let's go to someone on the phone that may have a question for us today.
Governor, this is Stephen Groves from the AP. Did you get another shipment of testing supplies this afternoon, and when are you expecting more to come?
We did not get another shipment this afternoon, but we do expect a shipment within the next day or two, we're hopeful. We do have enough supplies, though, for certain to get us through the next several days.
Yes, Governor. This is Gail Van Genderen with the South. And what I was wondering is, what type of testing are we doing right now in our South Dakota airports?
This is Kim Elson-Reisen with the Department of Health. We are not aware of any screening happening in South Dakota airports. In fact, we're seeing a decrease in screening at international airports as we work to kind of contain the spread.
Governor Nelm, this is Lisa with the Argus Leader. Just wondering if you're planning to do anything at this point in terms of closing bars and restaurants.
We don't have any plans at this time. Obviously, every day as we get results from tests that have been processed, we check to see exactly what those positives lead us to believe as far as what we know for thresholds that are defined by the CDC as meeting requirements to make adjustments to what we've already done in the state of South Dakota. So no, today, following those guidelines, we don't have any actions planned to do that.
Do we know the gender and age ranges of the new cases today?
We don't have those today. Do you have the? I'll let Kim give you what we can share tonight, and I know our infectious disease team will be visiting with them to get more information, and we'll have that for you by tomorrow too. The 3 cases reported today, 2 are male, 1 are female, and the age groups are 1 in 30 to 39, 1 in 40 to 49, and 1 in 60 to 69.
Governor Lee with South Dakota Public Broadcasting. I was wondering if you could talk a little bit more about what the infectious disease team will be doing in Butyl County, and how will, if this is community spread, how will that change the state's approach to this?
This is Kim Elson-Reisen. So the process for investigation is once the patient is notified by their provider, Department of Health staff contact the positive person. We will be doing that yet tonight, if at all possible, and then we start an interview process where we learn more about their situation, understand what symptoms they might be experiencing at that time, make sure that they're following their provider's recommendations. We will do extensive interviewing to get to any people that they would have come into close contact with. Now, I just want to reiterate what happens, or what is supposed to happen, is that when a person's sick, you should stay home, call your provider, and if you are tested for COVID, the direction is to stay on self-quarantine at home until you know those results, or 14 days. So we hope people are following that direction and that the close contacts will be minimal. We look at travel history, we look at dates, and so that helps us understand kind of that person's situation. I think the governor's addressed on many occasions that if we have community spread, then we will be working through the guidelines that the CDC has put out. A lot of people are already implementing community mitigation standards and strategies, and that's what's really helping us keep our cases down. So the governor's action to close schools has really contributed towards that as well. But a lot of people are doing things to help prevent the spread now.
Governor, this is Steve.
I would just reiterate the fact that we did 94 tests today of high priority tests, and the fact that 3 of them came back as positive was good news for us. It's encouraging because obviously we weren't able to test yesterday, and this was something that we knew we could possibly see a bigger increase, and we were thankful to see that many of the actions we've already taken are obviously working, and we're looking forward to continuing those processes. When we learn new information, we obviously could make adjustments, but today we will stay on course and be faithful to what we've already laid out as the path to protect our people's health.
Governor, this is Steve Long from over at KOTA and KEVN in Rapid City. And there's some concern, at least here West River, about the difficulty in getting tested. Since a lot of authorities are saying the majority of folks that are positive are asymptomatic and don't have symptoms, but can still spread the virus to the more vulnerable folks. We're wondering if there's enough testing being done. If maybe you can't just go in and get tested if you want to, and we're wondering if that if we could loosen those restrictions a little bit, or what you think about that.
Well, I just want to remind everyone that if you aren't feeling well, you should call your doctor. You should call your provider, and they will go through a protocol that's been laid out by the CDC to determine if you need to be tested or not. And also, when we go through that protocol, if individuals are tested, many times we don't have therapeutics that will bring any relief to their symptoms. It is mainly to identify and how we can protect and isolate people so that they aren't infecting other folks. I certainly understand people desiring and wanting to be tested. The concern is that no other test or lab test is given out just because somebody wants it. We're certainly following traditional medical practices by running through protocols that are laid out by providers to ensure that a lab test is needed. And so we are conducting these COVID-19 tests and protocols just like we would any other lab that would be ordered, and making sure the provider is the one determining if that test should be sampled and sent into our health lab here in Pierre. That is something that the patient is working through with their provider. It's not something I decide or that we're deciding at the state level, but I do know our providers in this state are certainly doing and following the guidelines that CDC has laid out for them.
If I could just follow up, but if most folks don't show any symptoms and we're only testing people that do have symptoms, those folks that, the majority of folks that have it and can still spread it, we're not identifying. Do you see what I'm saying? I mean, is that a concern for you?
I am, but we certainly in this country don't have enough supplies to test everyone. And so we are directing and targeting the normal protocols towards individuals that we believe would be high priority. So we're testing individuals that would come into contact with vulnerable populations. Some of the people that we tested today were called high priority because they work in the healthcare system, because they work with elderly people. They were high priority because they do interact with vulnerable populations, and we want to make sure that we don't expose them to the virus. So, not necessarily every person that came in to get tested was necessarily showing a ton of symptoms and was very sick. They were tested because they potentially were concerned they were exposed and they worked with a vulnerable population that needed to be protected. So these are all guidelines that are laid out by the CDC that the state of South Dakota and our providers are following through on.
Governor Ray Yost asked me to ask.
What readiness is the South Dakota National Incident?
I'm going to wait for the question on the phone, so I'm going to take one from Bob here in the room.
Ray Yost at Kellerland asked me to ask you about the status of the SBA.
Mm-hmm. So, yeah, the question was about the SBA approval process that we need out of the federal government in order to start processing some of the loans that are available through the Small Business Administration. We do not currently have approval from the federal government and the Small Business Administration on moving forward with the program yet, but we do anticipate that we could get it at any time. We have got all of our paperwork in and our applications in, and so we're just waiting for that stamp of approval so we can move ahead to bring some relief to our businesses. Okay, I'll take the question on the line if it's still there.
What readiness is the National Guard for this outbreak?
I think you asked something about the National Guard. Do you mind repeating?
What readiness is the National Guard in this?
We have a member of the National Guard that is in our Emergency Operations Center that is a part of the team that's responding to this COVID-19 virus across the state of South Dakota and working with all of our agencies and departments to respond to this public health need. The National Guard obviously is prepared and willing to help if necessary in the future, and we appreciate their service to our country and to our state.
Governor, this is Stephen Groves from the AP again. Do you have an idea on how many tests are or any supplies for tests are available in the lab now?
I didn't hear all of that, Stephen. You asked me how many tests and supplies that we have now. Is that what you were asking?
Yes.
We currently have the capacity to test for several days, up to 100 high priority population tests, and so we feel that that is adequate for the next several days. And again, as the governor indicated, we're working really, really hard on getting supplies and have some orders that we are hopeful will come in the next coming days. We also have some low priority cases that we have here at the State Public Health Lab that we will be sending out to commercial laboratories that are processing those. And so we will be getting results for those as well. We're just in partnership now that some commercial labs have come online. We're cooperating with them to get the results back to those people.
Kim, I just need
What and where are commercial laboratories? Are they in the state?
This is Kim Malsom-Rice, and so there are currently no commercial laboratories located within South Dakota, but there are laboratories located in other states that have just brought on and been approved by the FDA to do COVID-19 testing. So we're taking advantage of that opportunity, and in the future, we will be directing providers that are doing tests to direct any low priority tests to those commercial labs, so that we're really reserving the state capacity for those high priority populations. Our turnaround time, we want to maintain the great turnaround time that we've had. That's been 24 hours when we have the supplies. And we feel like that's the best approach moving forward.
What's the turnaround time for a commercial lab for somebody in the state?
That varies by lab from 4 to 5 days usually.
Okay, thanks.
Yeah, Kim, I just need to be clear on the Beadle County situation. Which person are you still looking at? I mean, not by name, but.
Right. So we will be investigating all 3 new cases and looking at the travel history of all of them. 2 have reported travel history. We need to verify information about that. We will also be investigating and working with all 3 cases around who they've come into contact with.
And then, Governor.
Can you specify the age range and genders of each person, just so we know which age corresponds to gender?
Oh. No, she can't tell you the specific age. Do you need the age ranges and the gender repeated again? Okay.
Yep.
And Bob, I want to remind you that we did have 1 previous case in Beadle County too. So this would make it a total of 4 cases in Beadle County. So we have 3 positive cases in Beadle County. The age groups are 30 to 39, 1 person in the 40 to 49-year-old range, and 1 person in the 60 to 69-year-old range. 2 of the people are male, 1 is female.
Can you say if the men are like 30s, 40s, 60s, and if the woman is 30, 40, 60?
I'm sorry, I don't have that information with me right now.
Okay, thank you.
We got the results of the tests, and within an hour, contacted the patients, worked with the labs to contact the physicians who contacted the patients, and then held this press conference to let people know. So as we continue to speak with these patients and gather more information, we'll certainly share what we can and what we're at liberty to share.
One last question. In regard to a case in Minnehaha County, are they still all at home, or is there now 1 in the hospital?
To my knowledge, all of the cases in Minnehaha County remain at home. We do maintain contact with all positive cases on a regular basis and check in with them. But to my knowledge right now, they are not in the hospital.
Do you have an indication of the condition of the new cases? Are they at home, hospitalized? What's their status?
Again, I can't provide a lot of detail at this point. We will be contacting each one of them yet tonight. None are currently hospitalized, however.
Okay, thanks.
Governor Nome, I was just wondering, you still have hundreds of tests that still need to be processed at the lab. And, do you think it's fair at this point to still say that there's no community spread when there's still tests to be run?
I have to use the data and the facts that I have to back up what I say. So the tests that we have results on determine how I define community spread in the borders of South Dakota. We also will be sending quite a few of those tests, those low priority tests, out to get results back from other labs too. So we're working as hard as we can to get them all processed in a timely manner so that we can stay atop of what our status is right here in the state. So anyone who would definitively say that we do have community spread would also not be basing that on anything that would be factual at this time. So everything I'm reporting to you is with knowledge that we currently have based on facts and data.
Hey, Governor, would it be possible just to recap how many total cases that we currently have that are positives?
Well, we had 11
yesterday.
Yep, we had 11 previous to today, and then 3 more positives would bring our total to 14. If you want more detail, I can have Kim go through the total number of cases and counties and ages if you would like.
Still no West River cases, though, right? Positives?
We have one Pennington County resident who tested positive. We've addressed that in prior press conferences. That person had not been in Pennington County recently. So that is accurate, but you will see on the covid.sd.gov site one report of a Pennington County case.
Okay. Thank you.
And the reason that's reported that way is that they obviously at the federal level want reporting from the county of residence. This individual was lived in Pennington County but had not been there for 2 weeks prior to him passing away.
Okay, thanks.
We have time for one more question.
I was just going to ask real quick, Lee, with SDPB. I was just going to see if you'd been talking with legislative leaders about any sort of legislative package coming up for on veto day.
I know that my team's been discussing some with legislative leadership about some options, but no decisions have been made. And obviously, we've all been in communication with legislators answering different questions throughout the week. But if there is a decision on something that needs to happen on veto day to address this COVID-19 virus, we certainly will be calling them together to have that discussion over a conference call before we get to veto day.